Thank you very much for joining us today on the program Healthy Living. My name is Adesuwa Osa Oagem. We have been doing quite a number of things on the program. We have talked about diseases. We have talked about how to get yourself started again when you fall ill or when you have a medical problem. We've also advised you on where to go to. We have done quite a number of things to improve your life on the program Healthy Living and also my life. But today on the program, we're going to focus on the health sector itself and those at the forefront of the fight against the COVID-19 pandemic. We're going to be looking at improving the health sector in the face of COVID-19 or post-COVID-19, as the case may be. And we have the chairman of the NMA, Edo State Branch, Dr. Valentine Omoifo, as our guest. The Nigerian healthcare system is poorly developed and has suffered several backdrops, especially in this period of COVID-19, the new normal, so to speak. So we are now in the new normal, and Dr. Valentine Omoifo is going to be talking to us on this issue. It's nice to have you join us, Doctor.
Thank you very much. My pleasure.
All right, it's no news that the health sector has really suffered very well, and it is poorly developed from what we read, from what you people talk about, from what the newspapers are saying, from what is happening in the system. And we are going to look at that health sector today, post-COVID-19. So before this period, Doctor, how would you say the health sector or the health system has fared?
Thank you very much, Adesuwa. Thanks for having me on this program.
You're welcome.
You see, for many of us who are stakeholders in this sector, it's not news to us that the sector has been ill-prepared, ill-developed. You know, we're talking of post-COVID, but let's start from the pre-COVID era.
Pre-COVID, yeah.
You will discover that when the COVID pandemic came around, we had to be, involving the fire brigade approach, rushing to build some structures, rushing to buy basic equipment, It was very funny. You will recall that over the years, the NMA and other pressure groups have been clamoring for improved funding of the health system, improved facilities in the system. But it hasn't been very easy. Let's take our minds back to 2011. Remember the Abuja declaration then, when African heads of state met?
That was sometimes in April that year.
Yes, and they signed a declaration that member states should provide 15% of the annual budget for health. But I can assure you that almost 20 years down the line, instead of increasing, Nigerian government just cut its health budget by 50% in 2020. So
instead of increasing.
In
going
fact,
by the Abuja resolution.
The highest we've gotten to is just about 5%, even 4%.
Not even 10.
I said the highest we've attained is about 5%. And now we're even cutting what we are operating on by 50%. I'd like to tell you that, the political will, to develop this sector is lacking. That is why you see some Nigerians were happy when the elites were the ones involved, at least they were the first victims of this infection. And people were clapping on the street that there's nowhere to run to.
No more medical tourism.
Nobody could run abroad. So our people had to look inwards and started trying to see how to develop our own system. You see, this wasn't necessary. We had all the time in the world, but starting from basic structural, properties, buildings, is lacking.
Yes.
Not all of equipment, not all of the personnel. If you look at Edo State, for instance, we have been complaining. The last time there was a major employment of health personnel was during Osumbo's regime. After then, what you have is just trickles here and there. You don't even have personnel. If you go to a lot of the health centers, in the rural areas, private health centers, specialist hospitals in the local government areas, you have just maybe one doctor, one nurse.
That's quite sad.
You don't even have the personnel. You don't have the buildings. You don't have infrastructure. So government needs to wake up. It's more of rhetorics every day. We go to the polls, they tell you we're going to take care of health, roads, but at the end of the day, the people don't get anything. This is where we found ourselves. But we want to hope that post-COVID, our leaders would have learned the lessons the bitter way, and we hope that we'll all come back to the drawing board and sit down together and plan.
Let's talk about this Abuja declaration.
Yes.
The 15% compared to 4% that we're getting today is a far cry. Perhaps the NMA is not doing much, or stakeholders in that field are not pressurizing the government enough to make sure that we attain at least some level in our society, because the health sector is really suffering. I've been to the hospitals. I've seen things myself. Nobody had to tell me anything. I've seen things myself. People have talked. I've done a couple of research myself, and I see that there is serious problem in that sector, and everybody needs health, particularly this period. What is the NMA doing?
Yes,
I know that resident doctors went on strike. We'll talk about them in a couple of minutes.
Yes, thank you very much for that question. You'll be surprised to note that all what NMA and doctors have ever gotten from government in this country was achieved through strike. To me, that is highly irresponsible, of the government, because they know what to do. At times you clamor, you send emissaries, you write letters, you do protests. Government doesn't listen.
Is it that the health of the citizen does not matter?
Well, you've said it yourself, because
I'm asking.
Because it would appear that will be the bitter situation we'll find ourselves. Because let me tell you, I watched on ITV one day of a hospital at Otuo area. This is a general hospital that has been built, furnished with all the equipment, with solar powered
and everything there,
24-hour light supply, but it's not been in use since Oshomole's regime. We have presented it to government several times. We've had a point to present one-on-one to government, and they tell you we'll look into it. What are the politics behind such? If you go to that place, people who are in that environment, they travel all the way to Irua for basic medical health care. And they have a fully equipped hospital right in their backyard.
What's the politics behind
it? They tell you maybe government has not fully paid the contractor, maybe what is supposed to be cited there, some political fact. And I ask myself, this is health. We just seem to play politics with our head. And that's one of the dangers we're facing in Nigeria, until the government officials, those who find themselves in government, they see the need to take the health of the average Nigerian seriously. We won't move. No matter how much the enemy clamors, no matter how much doctors go on strike, you'll be shocked that the government budget is just about 2,000 naira for the health of each Nigerian for a whole year.
2,000 naira.
From the recent statistics from that.
That's hazard allowance? Or
no, I'm talking for the health of the average Nigerian. Going by the budget you have in this country, it's just about 2,000 naira per year, per person. So what would that do for an average Nigerian? We're talking about maybe over 40,000 naira, over 50,000 naira in other countries, over 100,000 naira and above. So that will tell you that we need to begin to ask questions, demand from our government, what are you doing for our health? Because where health is wealth. Any country that is sick cannot even develop. You can't talk of developing other sectors. So, you see, we just need to tell the government, tell ourselves as citizens, let us move forward from where we are. You see, we are lucky today, COVID was not as severe as we anticipated it would be.
But the numbers are rising by the
now,
day.
when I mean whether that is not severe, initially we were expecting a lot of fatalities. Now, our aim there was to prevent, the spread, because we know if the spread was, outrageous, we don't have the capacity to cope. That's why you see the enemy, you see doctors saying, look, adhere by government restrictions, stay in your house, because we're scared for our people. Because we know what we have on ground. Even though we are doing some fire brigade approach, but we know it wasn't going to stand the test of time. So the government just needs to understand. Look, we are not strangers to Nigeria. We heard the president's wife say in the Asoro clinic there was no syringe, even though billions of naira were budgeted for that clinic annually. I can tell you that the money that clinic gets in the budget is more than the money for all the teaching hospitals in Nigeria in a year. And yet they don't have syringes, they don't have basic ultrasound, nothing. So you ask yourself, even the little that is budgeted, what happens to it? Is it released? Is the money used to implement the health system? I think the answers are there for everyone.
Unfortunately, it's not just in Edo State that we are having this problem. It's all over the nation. And people are beginning to wonder what should be done. what should everybody do to make sure that an average Nigerian gets the best of healthcare? At least for now, no more medical tourism and all that, but I know people will still travel once once we ease up. Yes.
I think to start with, I think we should make our leaders more accountable, for their actions, because what we're talking about transcends the health sector. There's a global decay, infrastructure, generally, even though we're talking about the health sector today. So what we are seeing in the health sector is just a spillover of what's happening in the larger society. When those in government are not accountable to the people, when the rules, the regulations are not being obeyed, nobody is there to enforce them. It's just like, business as usual for everybody. There's no way things can work. For instance, we talked about the COVID. Sorry, I'm always going there because that's the in thing now. Of course, if you move around town today, you see there's no level of enforcement whatsoever for the basic hygiene tenets.
A lot of persons do not believe that COVID-19 exists because they think it is politics to rake in money.
Beautiful. There may be the political aspect of it. I can't disagree. But the fact that there's COVID is real. We all know. We've seen people die from it. We're talking about over 500 deaths in Nigeria. We're talking about 60, 80 something or close to 95 deaths in Edo State. These are human beings. They are people, even though it's not very fatal. But what I'm saying is this. All over the world, people do not beg to obey government rules and regulations. Government enforces the rules. Even in America today, there are deviants. There are people who say, no, we don't believe in the mask, we won't use it. But the government, it's the duty of the government to safeguard the life of the head of the population. The government must enforce the rules. Even in the UK, there are fines, big fines. If you are caught not wearing your mask or not obeying the social distancing rule, you are fined. There must be a way to keep people in check. All over the world, human beings are known to want to break rules.
Of course.
But if we have a government in Nigeria today, we talk about interstate restriction. You and I know that this is just a mirage. People travel freely around the country. I drove through New Benin, New Lagos Road across the market 2 days ago at about 8 a.m. I was amazed. I couldn't even drive my vehicle through the road because of the mass, the crowd of people everywhere. None of them, not even a single one, was wearing a mask. People jostling and hustling in the marketplaces. Our politicians hold rallies openly, freely. No protection, no mask, no respect for distancing. So if you see these kind of things, how will the people believe? When the leaders themselves do not even seem to obey what they preach. So you can't blame people for not obeying or not believing. That will further enhance their belief that these leaders are just trying to deceive us to make money.
Okay, we know that COVID-19 has really exposed Nigeria's wobbling healthcare system. And then that brings my mind to the fact that hospitals abroad get better attention. Perhaps that is why a lot of big Nigerians and those who can afford it run abroad to get medical treatment. Now, when they go abroad and see the facilities that they have, the attention the medical institutions are getting. I understand that there's a hospital that has been there for like about 131 years. And that hospital is still there. There are hospitals like Johns Hopkins and the rest of them, and Nigerians go there. Big politicians go there, even medical doctors go there. When they go there and come back, why is it difficult to replicate, to some extent, what they saw there, or the facilities that were used to treat them abroad? Why is it so difficult that we have to be running helter-skelter for ventilators, and at the time we ran out of beds in some states in Nigeria? It beats me hollow, like my colleague was saying.
You see, thank you very much. You see, like I always tell people, these things, there is no hard and fast rule about the operation of these institutions you see abroad. You ask yourself also, if our leaders do not see the quality of roads they drive through when they go abroad, the drainage system, the power supply. So like I said, it's just a general decay. It's our perception of things. Our leaders believe, I don't know, somehow, that we do not deserve to get proper...
It's getting attention now in the health sector.
Yes. What we are seeing now is just a fallout of the decay that has been there. It's a pity, like COVID came in, and it was imported, so the aliens had to catch it first. They are the ones that were flying in and out of the country. In fact, like I speak to you now, I'm not sure if I'm going to my village yet because they are far from the center, you know. So, like I said, the political will is not there. You need to fund the system. It takes money to, build a healthcare system. It takes money to train resident doctors. It takes money to provide facilities. Some doctors have been sent abroad to train. On returning, they don't even have the facilities to use to practice what they've gone to learn. And if you ask me, these things are cheap. They are cheaper than sponsoring political rallies. At the time, one of our colleagues in UBTH, was into stem cell transplant, the former president, asked somebody at a meeting, is this thing really true? And he said, yes, it's true. How much does it cost? When he was told, you can even buy with the center in every state. In every state. That is how cheap these things are. But like I said,
so why is it difficult to implement?
The political will to do these things is lacking in our leaders.
How can the people hold the government
responsible? Because they believe they can always zoom
jet out. But those who cannot jet out, how do they hold government responsible? So how are we going to hold government responsible? How do we hold them?
We all have to be part of this fight. We in the health sector, you in the media, the man on the street. We must all understand that we must take our destiny in our hands and cry out and complain. I can assure you that you will still see the happy Edo man tomorrow screaming and fighting for politicians, even when they know that these people are not giving them what they deserve. So we must tell ourselves the truth. We must ask our leaders. Now elections are coming again in those states. People must begin to ask their leaders, what have you done in our health sector? What is your plan?
Unfortunately, Nigerians forget easily.
That's the problem.
Somebody comes up and gives you promises after promises after promises, and those promises were not fulfilled. And then maybe the person or another person will come up again and give us that same line of promises. Why are we so gullible and find it difficult to hold our leaders accountable to give us what we deserve as a nation, particularly in the health sector? Because if you look at the health sector, it is the ordinary Nigerian that is suffering. It is the ordinary Nigerian that will not get quality healthcare system, healthcare provisions in the country.
If I may say, I think we need to change our orientation, to governance.
Who change it for us?
Now, like I said, at times people, they don't just get carried away. They see the truth, but they don't bother to buy it for selfish reasons, for greed, for nepotic reasons. This man is for my community, he must be governor by all means. This man is for our party. So people are not bothered about the immediate until they are faced with the problem. Let me tell you, we're talking about permanent healthcare at the level of local government. The other time we heard we're commissioning about 20 primary care centers. You can go there and take a look by yourself. Nothing is happening in those centers. There are still no facilities, there are no people to work there, no drugs. Go and take a look. Government just come, they commission things, there's no follow-up. And the people that go to these facilities, they know, they go there, they can't find things to use, and they don't even complain. These same people will come, the elections will come to, will be giving money, and they will vote the same people into power. So MMA cannot do anything. The nurses association are there, they are also crying. The health workers are out there making complaints. But at a time, they begin to blackmail us.
Now, the resident doctors went on strike not too long ago, even though we know that it is not over yet, because there are some things that are still hanging. And then a lot of persons come out to say that you doctors will not to go on strike. Every little thing you go on strike. What are the challenges you're facing at those in the forefront of the battle, so to speak?
Yes.
What are the challenges you're facing that warrants the incessant strike?
Now, let me tell you, even before COVID came around, there were myriad of challenges in the health sector. You just on your own said that you've gone around, you don't see facilities.
Yes.
These things affect the work morale of the people. No doctor wants to see his patients die.
I know that
for things that you can easily manage.
At a time in a certain public hospital in Edo, patients were asked to wear hand gloves and the rest of them.
Beautiful. So you see, nobody wants to see his patients die, especially for things can easily be managed. because of lack of facilities, because of lack of drugs, because of lack of basic amenities. At times they say there's no light, they can't buy diesel. At the time I heard people were taking delivery with torchlight phones. I mean, these are embarrassing situations. Now, you see, there are already enough hazards in the profession.
Okay.
Now, to add all this to it again, and look, it's monumental. Now, look at this COVID that has come. We told government, we're talking of isolation centers, we're talking of people in the forefront, people at risk. I can challenge government anytime. The doctor in the OPD clinic in UBTH is even more at risk than the doctor at the isolation center. Because the man then knows the patient is already infected.
Okay.
The man is prepared.
Yes.
With his face mask, his gloves, everything, with the suit, head to toe, before he goes in to attend this patient.
Yes.
But the man who is in the general hospital there, in UBTH, in that clinic in Niroa, is seeing every other patient like me and you who has appendicitis, who is pregnant, ANC. There is no guard. The man doesn't even believe these people. He's just suspicious.
Suspicion, yes.
He is more at risk. And I can assure you those who have died of COVID are not those in the isolation center. They are those in the general, in the ordinary hospital settings treating patients. That is why the federal government in its wisdom said, look, we need to upgrade your hazard allowance you're getting as doctors to compensate for the hazard. But some states say, no, we only pay the isolation center. I just say it's one of them. And I told the government, look, this is the situation. The nurse that is going to attend to patients in UBTH, in the open world, she is equally at risk, even more at risk than the nurse in the isolation center who is prepared for the eventuality. She knows. So these are the rationales that those in government has refused to accept. Let me tell you something. There is a Respiratory Training Act that has been signed into law by the federal government. But most of those states, they won't implement it. There's a time frame for the training. You know, the day the same doesn't like the first, the doctor is okay, you finish your program, you are exited. Even though there is a law that says you have a stipulated time. He said, no, we have not started implementing it. Things are just done haphazardly. And the resident doctor said, no, government must implement your own law. So the letter that you have signed, that is one of the things they were clamoring for. Now you see in some centers, doctors are being paid different salaries. State is paying their own, local government is paying their own, federal is paying their own. And even some states say, no, we cut the salary by 25%, like Kaduna State just did. Even in the midst of COVID. The state government literally cut all workers' salary by 25%. And doctors say, no, if I have increasing doctor's salary, you are cutting us. And the man said, if you complain, we'll sack you. That was oppression. There was the case of some doctors that were sacked in Jos Teaching Hospital because of the non-implementation of the Secondary Training Program Act and all that. And the member said, no, you must reinstate our people. About 29 doctors have been sacked. Even though the minister has intervened and said, look, reinstate them, CNB said, no, they will not be reinstated. So that is a union affair. You know, we are in this country, federal government on its own came and said they're going to pay some allowances. They refused to pay it. They had to wait for doctors to go on strike. You see, it's painful. Like I said, a minister, Dr. Chukwu Oyebuchi, a former minister, he said 2 months ago that he's ashamed that all the things doctors have gotten for the healthcare sector in this country was through strike.
And that ought not to have been.
It shouldn't. And this strike we're talking about, they don't just wake up and go on strike. It's like a prelude. You write, government, this is what we want. Please, we're giving you 1 month ultimatum. We're giving you 2 weeks. It keeps coming. Oh, they wait until the people actually go on strike before they say, okay, come, what's the problem? So you see, like I said, it's the political will of those in government. It has to change.
You talked about blackmail the other time, that when you agitate for what is missing in the healthcare sector, you doctors are being blackmailed. Tell us about this blackmail.
No. You see, it's obvious.
Because our focus is on the health sector.
Yes, it's obvious.
And those of you in the forefront of this battle.
It's obvious. We may not want to go into so many, details, but not too long ago, the enemy of those states, was the victim of such. When the COVID was just starting, we had written to the state government that there was need to scale up action that, are geared towards preventing this disease, and like we always do, we brief the press occasionally on what we are dealing with government, because while we do that, several times you write to government, they don't even respond. They don't even acknowledge your letters. So what we do these days, we try to carry the press along, because people know that we are complaining. People know that we are clamoring. Yeah. But we're not just sitting there in our court of our rooms and relaxing. And after I wrote that letter, government called the NMA, to explain why these things were happening, and we were happy. Only for us to see a letter written to us again from government that was published in newspapers, castigating the accusation that we were spreading falsehood. We just demanded that there should be some interstate restriction. Look, government should go ahead and enforce its own rules by way of distancing and all this, that they can do better. At that time, we were worried why the association center was still not functional, even after we knew it was there. And the government had explained to us that, look, they had to do some last-minute renovation, changing some things here and there, which was quite reasonable. The government took us on a guided tour of the facility because of our complaints. So I was wondering which one was falsehood. So you see this kind of blackmail, look, that the chairman is supposed to be part of the committee, we're not there. And I told you, look, we've done our best. If you go around town, we have billboards. We have some boy here in town trying to stimulate people, let them know the day of this COVID that is there. I tell you, some of our members are in the markets, sanitary women, you see medical women everywhere, sharing hand gloves and all that. The enemy had gone around hospitals donating gloves, face masks, sanitizers. We did it in UBTH, we did it in Central Hospital, we did it at IROA. These are ways we feel we can participate. We can contribute our own quota. You see, but you just have to be on the side of government, or else it's as if, so these days, even though we are careful, but we must continue to say the truth.
Speak out.
Like I tell you, we are still here today, I got interviews every day. There is need for us to scale up our enforcement in Edo State. As far as enforcement is concerned, Edo State is not, I would call the state maybe like 10%, if not less than.
All right, it seems as if with the COVID-19, other sectors of the health institution has been like downplayed.
Yes, it's expected. It's expected. Even though it's painful, this pandemic is like war. We all know that in the war situation, all efforts are geared towards winning the war at hand. Because like I said, you just have to be alive to be talking of other sectors.
But that's not enough to neglect other patients.
Yes. I beg your pardon, other patients?
I said that's not enough to neglect other patients who have some health issues too. No,
not the health sector at all. The health professionals are doing their best. In the hospitals, there's a lot of triaging of our patients. Every patient in the hospital is getting full attention, because not all doctors, are in the area of managing COVID. Yes. Although COVID can come to anywhere. There are selected areas where people are managing COVID cases, and all that. Okay. They have the designated laboratories where we are testing for COVID, nurses who have been trained, and the training is ongoing every day within hospitals, within health centers. More persons are being trained in infection control management. So the non-sector of the health sector is being neglected by, the professionals there. No.
All right, the program is Healthy Living on independent television, and I have the NMA chairman, Edo State chapter or branch. Is it chapter or branch?
Yeah, the branch.
Okay. Edo State's branch with me in the studio, and we're looking at improving the health sector in the face of COVID-19. You have questions to ask him. He's here, and he's going to be answering all of your questions at least. Let's talk about the health sector. Let's talk about the doctors who are in the forefront, who are fighting this battle, and other health personnel. We know that some tested positive, like in Abeokuta. I was listening to the news, yes. And my heart really went out to them. They're fighting, but they're coming down with the virus. We're just hoping and praying that God Almighty see all of them through. When your doctor gets sick, you can imagine what is going to happen to you. All right, the number is 052-290-573. It's going to be on your screen shortly. Ask questions concerning this issue. All right, the doctors are human too, okay? And the health sector needs to be worked on seriously, because COVID-19, whether you want to accept it or not, has kind of exposed the wobbling situation we have in the health sector. All right, doctor, while we're waiting for calls, can you just quickly tell us a little bit of what the health sector looks like now?
Well,
post-COVID, although we are still in the COVID era.
Yes. We are still neck deep in the COVID
era. So
how
is the health sector?
Well, like we all know, the sector is just grappling to settle. But we are happy, that government attention has shifted
a little bit, yeah.
At least we can see a lot of activity.
Shifted 100% or half?
100%, not 100%, just shifted, You see, in the initial stages of this pandemic, there was palpable fear in the air. judging from what we're seeing from other countries, those in government were scared, considering the fact that they couldn't go out for therapy, and government was actually apprehensive, not knowing what will happen next. Whether it was a blessing in disguise, we can't really say for now, but you could see, some, form of attention given to the sector. There was an attempt to build some center, like in Edo State, we've had an association center that has been there, but wasn't even equipped. So the government they equipped that one, although it was a 12-bedded center. They put in some beds, bought some ventilators, and then I think with some, support from some other personnel, they set up another center close to that, bigger, bought more ventilators, and we all know that it's about a hospital entirely has not been designated as a association center. Government has renovated that area. So there's some light coming to this sector. And we also know that in UBTH, in IRA, there's an attempt by government to also assist those centers, and more importantly, we're also aware that testing capacity has increased. Before now, only IRA could test, and UBTH is now also testing for the coronavirus. And that's good news for Edo State, because we know, at the time in the whole country, they had just about 4 or 5 centers that were testing. Edo had one. So if we look at it generally, I think government is beginning to attempting to look toward the health sector. We pray it should be sustained. Like I said, we don't need to wait for this kind of catastrophe.
Yeah, I was going to go to that. Should we wait?
I think going beyond that, government need to employ more health personnel.
Okay, let's quickly take this call. Hello, caller. Good afternoon. Tell us your name and ask a question. Good afternoon.
Yeah, I'm Peters from Peters.
Okay, reduce the audio level on your television set, please.
Hello, can you hear me?
Yes, I can hear you now.
Yeah, Peters calling from Benin. First and foremost,
okay,
I want to thank the health professionals for the job well done.
Thank you.
And we recognize that the state government is doing what it could to ensure that the pandemic is tamed in the state.
Okay.
But my question is this: how is it that, of course, those who have tested positive, not necessarily in their respective in the hospitals or the centers that are located to them, they're probably in their various homes, how possible it is for the hospital to reach out to these people and to give them specific treatment, particularly against the background that these same people take care of themselves without the input of those who are supposed to manage them.
All right, thank you. Doctor, you got a question?
If I'm not mistaken, he was talking about monitoring those who are not in hospital and all that. It's true. There's a lot of home care going on currently because the figures of infected persons have been rising dramatically. It's expected, curve will naturally go up, but we expect it to start coming down very soon. But my worry is that with the way we are not complying with basic rules, it may take a longer time and stay up there. Now, all over the world now, the therapy is being geared towards home management because we can't have space to put all the people, particularly those that are not very, very ill, those that have just mild disease, and those who are positive are not even symptomatic. What we do, they stay at home, there's a follow-up team that reaches out to them. In fact, once you are positive, you are giving some kind of, we discuss with you, tell you the procedures, what is expected. Even in your home there, you should be able to keep your family members safe. You stay in a room, you isolate yourself from your people, other family members. They are giving these tutorials on how to live. They want to give you food, they come with face masks, they put it, you need to protect your family. And some of them are placed on therapy. We have doctors, nurses who go to visit them at home. We will talk with them on the phone regularly to ensure that they are taking their drugs. They have home visits and all that. And within a few days, many of them have gotten well. Even the index patient in Edo State was managed at home. He was never even admitted in a hospital. So it's working.
So there's no need to fear.
There's no need to fear.
All right. Hello, caller. Good afternoon. Yeah, tell us your name and ask your question, please. Hello? Yes, good afternoon. Tell us your name, please. Please tell us your name and ask your question. All right, we may have to let that caller go now. So the number is 052-290573. Hello, caller. Hello?
Hello?
Yes, good afternoon.
Hello, good afternoon.
Good afternoon. Reduce the audio level on your television set so that the doctor can hear you properly.
My name is Professor Awo Benin.
Okay, Professor Awo.
Yes. I'm a little bit worried with the way the federal government is handling the health workers.
Okay.
Yeah, the health workers are entitled to some allowances.
Okay.
And during the period of answering them, only a particular group was compensated. So if this continues, I'm sure it's going to cause bad blood. And then the spirit of one person tackling this pandemic might be defeated. So I wish to inform the federal government that they should do better to compensate everybody across board at the same time. If somebody is entitled to 1 naira, give the 1 naira at the time you are giving 1 million to the other. Everybody should be treated equally so that there will be no bad things. Thank you.
All right. Okay, was just trying to re-echo what you said earlier.
Yes, yes. We, like I said, doctors had to go on strike, and government made this promise 3 months ago. I think it's wise to carry everybody along and make sure all health workers get what is due them, because it's a team, and none of the health workers is less important. I'm showing your station here that people who clean the floor, that people who do gardening and all that. So we encourage government, to ensure that ideally government should even we should be talking of health insurance policies for those who work in that sector because of the increased hazard. It's not like a soldier in the war front. We also believe they should be giving a lot of insurance policy ahead. If you lose your life in the process, what happens to your family? What happens to your wife? There has to be a package for people who are working in that sector.
This welfare package for doctors nationwide is the problem.
It's not just for doctors. Even other health workers also demand. They should all get. I think so everybody just pay 5,000 naira hazard allowance across board to everybody.
5,000 naira monthly.
That's what they were getting as hazard allowance before now. Monthly. That was the monthly hazard allowance for
5,000 naira.
In Nigeria. Before the current increment we're talking of now, that just led to a strike.
Wow. That's huge. Hello, caller. Good afternoon. Yeah, good afternoon. Please tell us your name and ask your question.
Good afternoon. I'm calling from Udowa, Miss Rhoda.
All right, Mrs. Rhoda, go ahead.
Please, I want to ask the doctor. They say the COVID-19 does not have a cure. So those people that they are saying they cure or describe, what are they using for them?
Okay, thank you, Rhoda. Okay, Doc, you got a question there.
Yeah, thank you very much. You see, this is a question to me that is very, very, very important that people understand.
Yeah.
Maybe somewhere along the line we may be able to demystify, this, doubt that people have. Now, COVID-19 is caused by the coronavirus.
Okay.
Now, like most viral infections, particularly the respiratory viruses, most of them are self-limiting.
Okay.
That is to say, if your body immunity is strong enough, naturally after a period of time, it should be able to curtail the viral activity, and then you will just be well. Like you have common cold, most times you don't even treat it after like 3 or 4 days, you get well, you stop sneezing. Now, COVID-19 is also a respiratory viral infection. Even without treatment, some cases will get well on their own.
Without treatment?
Even without treatment, some mild cases will get well. Your body immunity will be able to curtail it with time. For within 2 weeks, those very mild cases will just come and go. It's the ones that have, moderate to severe symptoms that, we tend to really manage actively. And we have drugs that we've proven to be able to assist your immunity take care of these ailments.
Okay.
Now, we do symptomatic treatment if you have cough for the cough with antibiotics. Now, if you have, say you have running stomach, we give you drugs to take care of that. Apart from that,
it's a systematic
we do
treatment.
symptomatic treatment. But apart from that, there are medications that have been shown, that have been proven to prevent the virus from being able to attack other cells. Because when the virus gets into your system, what it does on its own, the virus is almost like a non-living thing. It's just there on the surface. But once it gets into a living system, it hijacks your internal machinery and start to use it to multiply. It has to get into your cell. So there are drugs that prevent viral entry into other cells.
Okay. So that's
and when that happens, if you give you some of these drugs, it gives your immunity time to mop up the other cells that are there. There's no continuous multiplication.
Okay.
So even though there are no drugs to treat it per se, but there are a lot of adjuvant drugs that help to assist you curtail it.
All right, let's quickly do this call before I ask Doctor about the universal health coverage. It's giving me concern. Are you sure we're going to achieve that by 2030, as they said? All right, let's quickly take this call now. Hello, caller. Good afternoon. Hello? Hello? Okay, we don't have that call yet. So, Doctor, tell us about the universal health coverage. If we are going to be able to achieve it by 2030 in the face of all of these challenges that is bedeviling the health sector?
Thank you for that question. You see, it boils down to healthcare financing. You know, in other health coverage,
Okay, hello, caller. Hello, good afternoon.
Good afternoon.
Tell us your name and ask your question quickly, please.
Yes, this is Michael of
You're welcome.
Please, I want to ask the doctor a question.
Go ahead.
We are aware that these people are adapting brought in some drugs for us by the wisdom of the president to allow those drugs to come in as well. And the presidential passport on COVID-19 we're just doing some kind of things over the drugs we don't understand. Up to now, Nigeria has not been able to provide a drug for, treatment. We are still relying on all this hydroxychloroquine and some other pain reliever. So now, I want to ask, what is your comment, sir, over the Malagasy drug or the inability of the Nigerian scientists, the pharmacists, not able to produce even a treatment drug for this COVID-19 that is ravaging the country. Thank you, sir.
Okay.
I didn't quite get his question.
All right, we'll just let that person hope that you call us again, because it was very difficult to hear what you were saying. So we don't want to give a wrong answer to your question.
About,
the presidential task force and medication, but I couldn't pick it together. All right, let's talk about this universal health care coverage. If we can achieve it by 2030.
Yes,
this is 2020 now.
This is 2020.
In 10 years.
There were times in Nigeria we heard about health for all by the year 2000, water for all by the year 2020. One would expect that those years would never come, but we are in 2020. 2000 has passed, almost 2 decades
we're in 2020.
ago. Universal health coverage, we're talking about adequate healthcare coverage for Nigerians, all the population, affordability, availability, We know that you heard me talk about the primary healthcare centers. That is where healthcare starts from.
Starts from, yeah.
Even at that level, that should take care of most of the people in the rural communities. It's still like a mirage.
Okay, a mirage. We'll come back to that. Hello, caller. Good afternoon. Okay, doctor.
Yes.
We lost that call.
We are lucky that the Primary Healthcare Development Agency that has not been set up, but the task before them is huge. But it's a possibility, it's practicable that they can achieve it.
In face of all the challenges you have mentioned.
But there is proviso.
Doctor, let me hold you there. Hello, caller. Hello, reduce your audio level so that we can hear your audio level on your TV.
Can you hear me?
Yes.
Yes, thank you very much. I want to actually make further contribution. I called earlier, and I'm particularly worried about the issue of secondary contacts in Edo State.
Secondary contact, okay.
In Nigeria, but I think I will be more concerned, about secondary contact, how you are able to deal with the issue of secondary contact. We know the difficulty involved, and we recognize that once that someone is positive, and before that is, of course, before it comes to public knowledge, the individual will have had contact with other persons. How effective is the state? Or, of course, I want the doctor to explain this to me specifically. Okay. How you are able to tame or get in touch with those who have, of course, also contacted the particular person who is affected. Particularly when it is viewed against the background that it is not very easy to reach out to those who have been affected, and of course also the separate contacts involved. Thank you very much.
All right, thank you.
Yes, the caller made it clear by himself that it's not very easy, reaching the contact. The contact, yes. But you see, there are structures put in place at the level of the hospital, at the level of the state epidemiologists, who work, the COVID response team. Yes. We have a lot of people who do contact tracing. Okay. Once, even started in laboratories, once the case is test positive, contact tracing is done. The relatives, the brothers, there's what we call line listing. All those that have been, come into contact with those contacts, we are able to get their details, get their phone numbers, and there are people who are on ground who move to those localities to see these people and get them screened, tested possibly. So it's a very difficult procedure, but I can assure you it's going on. Okay. And the number of people who are doing this is increasing every day. Okay. The state government is cooperating with WHO in Edo State, we're training more persons to join the contact tracing. And funny enough, a lot of people have been traced, a lot.
All right, Doctor, time is not our friend, and in just a minute, I'd like you to answer this question. How can we, develop or at least make the health sector very robust in this dispensation, in this new normal life that we're living now?
Yes, thank you very much. All hands must be on deck to start with. It must be taken as a challenge for everybody. Because as it is now, everybody must participate. Everybody must contribute. You must play your own part. Keep yourself safe to start with. Keep your family safe. And then at the end of the day, the government must be ready to do the needful. We're talking with government, and we hope that government will listen. They must provide the required, facilities, personal protective equipment, the funds to run the hospitals, power, basics, and then training and retraining of manpower, healthcare professionals. I think if they do all this, and with the support of the people, because the people must be there, a cardinal part of the whole system. I think there's hope, because we want to be optimistic. We don't want to be so pessimistic to believe that the system will not work, because we know it's possible if we do what we are supposed to do.
Okay, and I'm also hoping that the Abuja Declaration will come to fruition one day, and then the health sector will be very robust. Yes. Because we like it that nobody is going on medical tourism and all of that.
So that means it shows that it's possible for us to take care of ourselves here in Nigeria. And we are doing it now. Okay,
that's wonderful. And I want to believe that everything is going to be perfect in the new normal. Thank you very much, Dr. Valentine, for being my guest here. All right, guys, this is it. We'll see you again on Monday. Before then, do everything necessary. Observe all precautionary measures to enjoy the new normal that we are in today. Thank you for watching. Bye-bye.